The American Cancer Society believes that all people should have access to cancer screenings, without regard to health insurance coverage. Limitations on coverage should not keep someone from the benefits of early detection of cancer. The Society supports policies that give all people access to and coverage of early detection tests for cancer. Such policies should be age and risk appropriate and based on current scientific evidence as outlined in the American Cancer Society's early detection guidelines. Federal law coverage of colorectal cancer screening tests is required by the Affordable Care Act, ACA, but the ACA doesn't apply to health plans that were in place before it was passed, called grandfathered plans. You can find out your insurance plan's grandfathered status by contacting your health insurance company or your employer's human resources department. If your plan started on or after September 23, 2010, it must cover colonoscopies and other colorectal cancer screening tests. If a plan started before September 23, 2010, it may still have coverage requirements from state laws, which vary, and other federal laws. Private health insurance coverage for colorectal cancer screening. The Affordable Care Act requires health plans that started on or after September 23, 2010 to cover colorectal cancer screening tests. Although many private insurance plans cover the costs for colonoscopy as a screening test, you still might be charged for some services. Review your health insurance plan for specific details, including if your doctor is on your insurance company's list of in-network providers. If the doctor is not in the plan's network, you may have to pay more out of pocket. Colonoscopies that are done to evaluate specific problems, such as belly, abdominal pain, intestinal bleeding, or low red blood cell counts, anemia, are usually classified as diagnostic, and not screening, procedures. If that's the case, you may have to pay any required deductible and copay. The same is true if colonoscopy is done after a positive stool test, such as the GFOBT or FIT, or an abnormal double contrast barium enema or CT colonography. Some insurance plans also consider a colonoscopy diagnostic if something is found, like a polyp, during the procedure that needs to be removed or biopsied. Before you get a screening colonoscopy, ask your insurance company how much, if anything, you should expect to pay for it. Find out if this amount could change based on what's found during the test. This can help you avoid surprise costs. If you do have large bills afterward, you may be able to appeal the insurance company's decision. Medicare coverage for colorectal cancer screening. Medicare covers an initial preventive physical exam for all new Medicare beneficiaries. It must be done within 1 year of enrolling in Medicare. The Welcome to Medicare physical includes referrals for preventive services already covered under Medicare, including colon cancer screening tests. If you've had Medicare Part B for longer than 12 months, a yearly wellness visit is covered without any cost. This visit is used to develop or update a personalized prevention plan to prevent disease and disability. Your provider should discuss a screening schedule, like a checklist, with you for preventive services you should have, including colon cancer screening. What colorectal cancer screening tests does Medicare cover? Fecal occult blood test, FOBT, or fecal immunochemical test, FIT, once every 12 months for all Medicare beneficiaries 50 years and older. Stool DNA test, Cologuard, every 3 years for Medicare beneficiaries 50 to 85 years old who do not have symptoms of colorectal cancer and who do not have an increased risk of colorectal cancer. Flexible sigmoidoscopy every 4 years for those 50 years and older, but not within 10 years of a previous colonoscopy. Colonoscopy once every 2 years for those at high risk, regardless of age, once every 10 years for those who are at average risk, 4 years after a flexible sigmoidoscopy for those who are at average risk, double contrast barium enema if a doctor determines that its screening value is equal to or better than flexible sigmoidoscopy or colonoscopy, once every 2 years for those 50 years and older who are at high risk, once every 4 years for those 50 years and older who are at average risk. At this time, Medicare does not cover the cost of virtual colonoscopy, CT colonography. If you have questions about your costs, including deductibles or copays, it's best to speak with your insurance company. What would someone on Medicare expect to pay for a colorectal cancer screening test? FOBT, FIT, covered at no cost * for those age 50 years or older, no co-insurance or Part B deductible. Stool DNA test, Cologuard, covered at no cost * for those age 50 to 85 as long as they are not at increased risk of colorectal cancer and don't have symptoms of colorectal cancer, no co-insurance or Part B deductible. Flexible sigmoidoscopy, covered at no cost * for those age 50 or older, no co-insurance, copayment, or Part B deductible when the test is done for screening. Note, if because of the test results, you need a biopsy or removal of a growth, it's no longer a screening test, and you will be charged the 20% co-insurance